Hey everybody, I'm Gary Axelbank filling in for Kibin Alleyne. Today is Tuesday, January 10th, and you are now watching Open, a program bringing the Bronx and New York City straight to you. As we start the new year, we'll take a look back at a previous interview done by Kibin Alleyne. This segment features the world's first HIV-positive to HIV-positive heart transplant recipient and also the transplant cardiologist. And they'll have a message of why it's important to be an organ donor. Let's take a look.
Now, the world's first HIV-positive to HIV-positive heart transplant has been successfully performed at Montefiore Health System, right here in the Bronx. Doctor, can you just tell me a little bit more about this remarkable story?
Yeah, sure. I know Miriam through our heart failure clinic. When I started seeing her, she was already listed for a kidney transplantation. And at one point, she actually received an offer for a kidney donor. But in the process of being listed for the kidney, and she was receiving dialysis, her heart had begun to fail. And we had used other measures such as putting stents in her arteries of the heart medications, but the heart function was continuing to get worse. And it became pretty clear that she would not safely be able to go the kidney only without a heart transplant. So we listed her for both heart and kidney transplantation. The barrier, with these transplants is that there's a severe organ shortage. So it's hard enough trying to get one organ, kidney, but when you combine it with two organs, with heart and kidney, it becomes even more difficult. So Miriam was listed for heart and kidney transplantation on the wait list, but she wasn't getting any offers. And fortunately, our program, one of the only two active programs that can do this. There's others that potentially can, but we're one of the two active ones, because we have a lot of history of transplanting patients that have a history of HIV with non-HIV donors. We've done that in the prior decade successfully. We were able to meet the criteria, and then me and Miriam had a discussion about this, about the risks and benefits, and we felt that this would be a very safe thing to do, and she consented to it. And we felt once we do this, she will be the only person that will be eligible to receive such an organ. Nobody else, no competition, first in line. So once we activated this pathway of receiving a HIV-positive donor heart, which hasn't been done before, but once we did activate it, within a few days, fortunately, the appropriate offer came, and our center carefully evaluated it. There's a whole team of doctors. I'm just one of them, infectious doctors, critical care doctors, heart surgeons, critical care physicians, a lot of doctors. We evaluated the organs and we proceeded with transplantation, and it was successful. She's received a normal heart, a normal kidney, and as you can see, she's doing very well. We're very happy how things turned out.
I want to ask Miriam, how did you feel knowing this procedure was possible?
Initially, it was very scary, but I knew that I had to take the chance, and I had faith in Dr. Saeed and Montefiore Einstein. And it was literally my only opportunity with a second chance in life. The waiting list is so long that I didn't think it would be possible for me to get a heart or a kidney via the normal transplant list. My only opportunity for a second chance was through the Hope Book.
Now, doctor, can you explain what were the possible risks, when you're doing such a procedure like this one?
Yeah, great question. So as with anything that hasn't been done before, there are risks. Sometimes there are risks that we can't necessarily think of, but to the best of our ability, we felt that this would be a safe thing to do. Because you have to understand, when the organs are being evaluated for transplant, before the transplant, we look at the heart function very carefully through multiple different methods. So that's not different in this case. But one potential risk was the idea of medications, that the HIV medications may have an interaction with the heart transplant medications. So we anticipated that, and our team, before any of this was done, looked at all the medications that Miriam would be on afterwards, and we made sure that it would be no interactions. So that was something that went according to plan. A lot of transplant medicine is what happens during the transplant and after the transplant, and those things we felt wouldn't be different in this case, even though the organ is coming from somebody HIV positive. But as long as these are normal organs, which we can judge beforehand, the process of transplant and afterward is just based on team expertise and everybody working together, and that's what we do all the time. So we felt we were more than capable of doing this. It was really, a lot of this was Miriam being very brave and this extraordinary act of compassion on behalf of the donor family that allowed this to happen.
Now, I want to ask you, how does it feel for you to be part of a life-changing procedure?
Me?
Hmm.
Oh my God. I am so grateful to be able to show individuals like me that are suffering from heart failure or even kidney failure that there's a second chance in life. Also, very grateful and thankful for the Newton family, for Brittany. She was a donor being HIV positive. And if it wasn't for Brittany, I probably would not be here today. So she afforded me a second chance in life, and that I will be forever grateful and thankful for, to her and to her family, which has now become my family as well. Faith and her generosity allowed me to have a new life today.
And you recently got to actually, meet her family. What was that experience like?
And that experience was very emotional and very beautiful. I know they lost a loved one, so there was a lot of emotions there. But for me, their loved ones live in me, and I just felt this natural connection with them. Um, and today we constantly texting each other, talking to each other. Just got a new extended family, and for that, again, I'm so very blessed and so very thankful that they afforded me a second opportunity in life.
Thank you so much for sharing that. That was really beautiful. Now, doctor, I want to start with you, but it's a question for both of you, actually. How does this procedure change the outlook society has on ideas with life with HIV?
Yes. So there's a feeling out there that because somebody has HIV, that they are immunosuppressed to begin with, and the HIV itself is a major risk factor. Now, this is on some level true, but the treatment for HIV, as we all know, has come a long way, right? It's no longer this severe disease acutely. There's medications now that can control the problem, and it becomes more of a chronic medical problem, and people live with it okay, and the medications are fairly advanced now. But this feeling still exists that transplanting somebody with HIV that's already immunosuppressed, and then now you're going to immunosuppress them further with the heart transplant meds, could be a dangerous thing to do. So that's there's resistance out there, but it's been done. Our center has been doing it for the last decade. We've done many patients with HIV, with the HIV negative donors, and those transplants have gone successfully. And there's reports, experiences of the whole country that show that the survival after transplantation, heart transplantation for patients with HIV, is actually similar to those without HIV. So that one barrier in this case, again, shows us that this is very feasible with good success. Number two, now taking a donor with HIV, I think this opens up another door exclusively for patients with HIV to receive these organs that otherwise wouldn't be used. This is a very shortage. There's a big shortage of donors. There's over 100,000 people listed for organs, and time is of the essence. The longer a person waits, the greater risk they're at, and we lose a person on the list about every hour. So we have to move quickly. And this pathway provides us just another door that we could open and take these organs in a safe way.
Now, Miriam, I want to ask actually, after you having this experience, why would you say it's important or how would you encourage people to become organ donors?
I encourage everyone, even myself now, I know I can be an organ donor. Before, I think there's a lot of ignorance as far as people with HIV, whether they could donate or not. And we can. So, and there's people like Dr. Saeed said, many of us, are on the list for years and years, and there's just not enough. And to save someone's life or to give someone life so they can spend more time with their families, more time with their children, it's a form of love. And I really believe that in today's world, we need all the love we can get. So organ donations is very important. If I don't need my organs, why not give it to someone that can benefit from it in order for them to have a second chance in life? And they carry on your legacy as well. So it's a win situation, in my opinion, for both the receiver and the donor.
Now, doctor, what should people know? What should people know just in general when becoming a donor?
Yeah, I mean, number one, a person has to think about this. It's not something that could be done immediately. So, as Miriam was saying, it's a gift of life. Really, despite whichever organ it is, every organ for a person waiting for them is life-saving. Whether it's a kidney, a liver, a heart, there's many organs that can be transplanted. So, for donors, they have to think about this. What their wishes would be if they got into a situation where they could donate. And then there's the logistics. In the U.S., it's more of a opt-in system. So you have to, if those are your wishes, you have to sign up for it. And there are several ways of doing that. One method is through the DMV. There are several other pathways as well. But I think it's important to think about this beforehand, where this is truly a life-saving thing to do for another person. Remarkable, what effect it can have on a person's life.
And I also quickly just want to know, I think it's a misconception about organ donating. Is it something that you can only do when you've passed on, or is it something that you can do while you're alive and well? Can you just clarify some things on that?
Sure. So this again depends on the organ that's being donated. Clearly, with heart transplantation, if a person has passed on and their wishes are to help somebody else. But in the case of other organs, could be a live donor, such as kidney, and people donate skin, other organs. So those don't have to be passing away.
Also, I just want to thank you both so much for joining us and for sharing this remarkable story.
Thank you for having us, and Merry Christmas. It's been a blessing to be able to see another one. Thank you, Dr. Saeed.
Thank you. Thank you so much for having us on, and happy holidays. Thank you.
To stay connected with Montefiore, please go to their website at www.montefiore.org, or you could follow them on social media on all platforms at Montefiore Health System.
It's a touching and, dare I say, heartwarming story. The BronxNet team would like to thank Dr. Omar Saeed and Miriam Nieves for sharing the amazing story with us and you too. We'll have to take a quick break. We'll be back with more Open right after this.